Welcome to the show. This is Liberty. Thank you very much for listening. I appreciate it. Today's show is going to cover plant medicines. We will be talking about psilocybin. Specifically, what I'd like to focus on is a study that was performed by Dr. Charles Grob. This study was examining the benefits of psilocybin on reducing anxiety associated with terminally ill cancer patients. I will be linking some information on Dr. Grob in the video description on YouTube. We'll have a link to his Vimeo presentation about this study, a link to MAPS, which maps.org, that is the Multidisciplinary Association for Psychedelic Studies. We'll also have a link to his Erowid page and a link to the Hefter Institute, which is also funding and studying various forms of psychedelic research. The specific study that Dr. Grob was involved in, it was called Cancer Anxiety Study Tests Psilocybin. And basically the study was focused on helping the quality of life for the participants. It wasn't The goal of the study had nothing to do with curing the cancer necessarily, but it's interesting to note that they were collecting anecdotal statistics to see if there were any impacts of their treatment on the actual illness itself, but those statistics weren't included in the overall report. When talking about anxiety associated with terminally ill patients, it's as you can imagine, if unless this has happened, you'd probably have to. That this is a life-changing diagnosis. This is someone who has had plans and aspirations for their entire life, various goals that they wish to meet, different things that they wanted to work on, and when you receive a diagnosis that you will be passing on in the near future, that throws all of those out the windows. It calls everything that you've substantiated in your life as what's a reality. It calls those things into question. And a big part of that is anxiety, and the anxiety can do with the perceived pain and trauma that'll be associated with the disease in the future, the various types of treatments with chemotherapy and medications and stuff that you'll have to go through, the costs involved with the various treatments, and can really shake you to your foundation. Now, this particular study took place at the Harbor UCLA Medical Center. The study used a synthesized analog of psilocybin, and that's to help keep in line with the standardization regulations that they had to observe to keep in line with the FDA approval of the study. One of the advantages of using psilocybin to treat patients is its extremely low toxicity. Paul Stamets stated, "You would have to eat your own body weight in one sitting to ingest a toxic dose of psilocybin mushrooms." This is compared to not necessarily just with terminally ill cancer patients, but other forms of anxiety which are treated with pharmaceuticals. They were treated on an ongoing treatment process, which can be very expensive, and it's can be daily, sometimes multiple times per day. You'll have to ingest some medication, and this medication usually comes with a whole host of side effects, and sometimes you'll even have to take medications to counter those side effects. So it has kind of a cascading effect on trying to maintain a low level of anxiety. Another one of the benefits to the use of psychedelics is it can be one dose or one session can be utilized and integrated and stay with you for weeks, months, possibly even years. So if you kind of contrast that with the ongoing expense and some of the harsher side of the chemicals, the effects on the body, and the things we discussed a few moments ago, this is obviously seems to be something that one would prefer over to some of the other methods that we've got with the pharmacology method right now. While the focus of the use of hallucinogens are practically unheard of today, it seems to be gaining momentum. We've got the maps.org people working with various forms of studies. This is all based on some of the work that was done in the 50s and 60s. There was a brief breakthrough with LSD, and then eventually psilocybin and some other medicines that happened at that time in the 50s and 60s, and it appears that over a 15-year period, there were over 1,000 clinical papers published, about 40,000 patients treated during a 15-year period with psychedelics. So at one point in our time, in our history, there was a very productive use of studying psychedelics and hallucinogens and treating a variety of different illnesses. Unfortunately, that was cut short when they were all made illegal, but we'll cover that topic in a successive show. And getting back to Dr. Grob's study, the basic methodology and outline of what was done was he had 12 subjects. As it turned out, there were 11 females in the study, and he himself said that he wasn't exactly sure why that was. While the age group that was acceptable was 18 to 70, it turns out that most of the people that were participating in the study were in their 50s. One of the criteria was metastatic cancer, and that the cancer had metastasized. A secondary diagnosis of anxiety had to be present, and there were certain exclusionary specifications to make sure that there weren't going to be any adverse physical limitations in the participants with high blood pressure or the cancer metastasized to the brain, or they had to be physically able to get to the study, which was in a hospital. And prior to the consumption of the psilocybin, there were preparatory psychotherapy sessions to kind of evaluate the participant, evaluate the participant to make sure that there weren't any underlying psychological problems that would be, brought to the surface by using a hallucinogen, or that might be agitated in some way by utilizing them in the study. The study itself was a double-blind, placebo-controlled study. That means that the testers didn't know if the participants were going to get a placebo or the actual psilocybin, and the participants didn't know which they were getting, which this was under. They had two sessions. One, they were given the placebo, and the other one they were given the psilocybin, though they didn't know in what order that was going to take place. This was accomplished by a third party, a third person in the study, which was the pharmacist, and he would fill the capsules, one with niacin. I believe it was 250 milligrams of niacin. And in this case, that was used as the placebo, I believe, because the niacin, one of the effects of it is there's kind of a flush. So there's actually a physiological difference that can occur. And, that's one of the reasons why it was used as the placebo. So they had one capsule that was filled with niacin, and then the other capsule was filled with the synthesized psilocybin. And like I said, they used a synthesized analog so they could control the dosage more effectively and control the quality of the medication in keeping with the FDA regulations of the study. And those were completely randomized by the pharmacist. So, like I said, the people giving the participants the medication didn't know, and the participants themselves did not know. There was a follow-up after the sessions, and this was basically an evaluation of their experience and to see how well they had integrated the experience into their life. They did, however, take some steps to kind of personalize the situation. They helped the participants kind of decorate the room that they would be in with various wall hangings, pillows, to help kind of ease them into it a little bit so it didn't seem like such a sterile environment, and help make them comfortable with what was going on. Some of the other things that happened, they had like covers over their eyes, like a sleeping blind that somebody might use to block out sunlight or any light in the rooms. They also had music that was being pumped through headphones that would help the person. Basically, what they wanted to do was avoid having conversations with the participant. They really wanted the participant to turn inwards and kind of internalize the experience and not be affected by any external stimuli. The music itself, they said that they tried to avoid anything with any English lyrics. They tried to, if the participant was interested in bringing their own playlist, they were certainly open to that, though they did have some specific music that they were interested, the testers that they wanted to use if the participant didn't have any interest in programming their own. This was various forms of like Indian chants, of percussive music. They didn't quite so much veer towards classical music, though they did experiment with some of that, and apparently the participant was not as open to that particular type of music, and they were able to listen to what the tester DJ, as they called it, provided for them, and that they enjoyed that experience very much. So they didn't want any English lyrics. They didn't want to lead the participant by telling a story or getting them emotionally involved in something that they may not be feeling from themselves, by using some sort of sad songs or upbeat songs or anything like that. They just wanted the music there to help them stay focused on internalizing it and kind of help them along the journey with a kind of guided session with music. So that's basically some of the things that they did to help. And throughout the session, they would come in once an hour and take their blood pressure and ask them how they were doing, making sure there wasn't anything, any problems with the session. Now, like I said, the focus of the study was to affect the quality of life for the participant. This wasn't in any way trying to cure the cancer or affect it in any way like that. This was basically to help them overcome anxieties that they were feeling that was a direct result of their diagnosis of terminally ill cancer. Now, 3 of the 12 participants became activists, and that means that due to their experience with the session, it was so life-changing that they actually became involved in speaking engagements and helping promote the study for people with terminally ill cancer, and working within the system to make sure that this wasn't in any way forgotten about or overlooked or abandoned, and that they felt that they had such a strong reaction of a positive effect that they actually became involved in furthering the program. One of the participants that became an activist her name is Annie Levy, and there's actually a video of her explanation of her experience with the study that's available on the Erowid page for Dr. Grob, and I'll link that video in the video description. If you go to the Erowid page under the video section for Dr. Grob, the video is called "The Use of Hallucinogen in Psychology." The use of hallucinogens in psychiatry and medicine, and it's very interesting, especially if you hear this firsthand from someone that was involved in the study. Now, this is some of the benefits that she experienced were she was able to focus on the immediate rather than being afraid of what might happen in the future. And like I said earlier, when you get diagnosed with a terminal illness such as cancer, it has I assume that it has a very great effect on the plans that you have for life. She experienced that she was anxious about some of the pain that she was going to go through, some of the loss of the people around her, how they were going to handle her dying, the impact that it would have on her family and friends. And afterwards, she noted that there was an improvement in her relationship with her husband. She was able to identify with some of the things that he was going to go through. She was able to make a breakthrough in kind of internalizing how he would be struggling after the fact, and it actually made her quite a bit closer to him rather than any form of isolation. And of course, that's another negative thing that happens to people that are diagnosed with terminal illnesses, is they tend to isolate themselves and get kind of caught up in the mindset of they're going to die, this is the end of it, and they're not able to create any new plans because they're not sure how long they're going to be around. And unfortunately in Western medicine we tend to focus solely on the physiological aspects of a disease and not so much the quality of life of the patient, of how they're feeling about it, the struggles that they're going through trying to deal with it. It's more of treating the physical symptoms, making sure they're not in pain, giving them the current cures that they have, the current treatments that they feel are applicable to the situation. So Annie was able to enjoy the rest of the time that she had left. She was able to travel with her husband. She also said that the benefits of her experience stayed with her up until the time she passed. She called or left a message for Dr. Grob and said that one of the experiences that she had, which was rather spiritual, in fact, stayed with her and was one of the things that helped her stay calm and centered and at peace up until, when she eventually did pass on. There was another participant that had similar experiences, that she had felt isolated, that she was quarreling with her husband, who was her primary caretaker at the time, and after the sessions she was able to connect with him on quite a deep level. They were able to travel, they were able to go out, and I believe that she spoke with people about this in various lectures and things like that. I think she was another one of the activists. Another person said that they had a very spiritual session, and during the session they explained the feeling of healing. And while this was not, of course, necessarily the healing of the cancer, it was more helpful to the emotional experience that she had, which was kind of the foundation of what they wanted to study and see if there was a benefit with the psilocybin in helping them repair their psyche and actually enjoy the last remaining time that they had left. One of the other participants described that the session was a deeply experiential learning phenomenon for them, that they were able to explore some parts of themselves that they had not before. They were able to overcome some barriers and learn more about themselves. Apparently, this is also one of the activists. He had retold his story over 30 times at lectures, and from what he says, really to anybody that would listen. He also noted that he was able to explain a significant difference in the recreational use versus medicinal use of psilocybin. Now, what all of the people, all of the participants seemed to share were very life-changing spiritual experiences, depending on, of course, what religion or spirituality flavor they were involved in. It was that influenced what it specifically was, but they all explained that they had significant spiritual awakenings. They all were able to enjoy the remaining time that they had left in their life rather than obsessing on the negative aspects that would be involved. They were able to deal with how their passing would affect others, their families, and their friends, and able to help bond with those people and get closer to them and have connections and carry out helpful and healthy conversations. Overall, it seems that the anxiety appeared to have been reduced with what was effectively a single session of the psilocybin. And that's very important. This is, it could be considered a treatment, but that sounds more like like a psychological and emotional cure, since it's only done in a single session, which our current modality is a treatment plan that's very expensive and requires daily and sometimes multiple daily applications of pharmaceutical medications, of man-made medications. And that works to varying effects, to varying levels of effectiveness, and can be very expensive. And again, you might have to take a medication to counter the side effects of one medication, and another medication to counter that, the side effects of that medication, and it can really become expensive and quite difficult to maintain. There's a number of things that I've left out, specifics that I've left out of this explanation of some of the research that I've done. You can find more specific information in the presentation that Dr. Grob gave, and I mentioned it earlier. It is accessible through the Erowid page for Dr. Grob, and that video is called, let me see if I can find it. The video is called The Use of Hallucinogens in Psychiatry and Medicine, and that's under the video section towards the bottom. I think it's the second link, and that was a video presentation that he gave, and that's where I gleaned much of this information. Of course, there's some other sources that I was able to get information from. The Psychedelic Salon has numerous podcasts that have included his lectures from various locations. I'll include some links to his profile on their webpage. And it seems to be effective. It's low toxicity, it's single session, and it seems to really have had a life-changing effect on these people. And that's kind of the focus of what I'll be talking about in the upcoming episodes, is how some of this medication that was used very effectively in the 50s and 60s to treat any number of things from alcoholism to schizophrenia to very debilitating. In one instance, a wasting syndrome of a child, they were able to overcome that. She was able to open up and become a productive member of her society. And this happened to her at a very young age, and it was a serious amount of abuse that got her to that part. But these are things that even today we don't really have very effective treatments for. So it's unfortunate that it was outlawed, but there seems to be a growing number of studies and a growing community that support these studies that are gaining momentum, and that's good for me to see. I'm very happy to see that. I've had my own personal experience with psychedelics, and I'd like to share that with you at this point. When in my younger years, I did not have a very good go at education as far as public schools went. To some background on myself personally, one of my parents had some trauma in their childhood, and it hadn't been treated, and in a household like that, it can tend to be passed on a little bit, and so as a child and a young adult, I didn't necessarily have the most effective mental and emotional health that somebody my age could have under the perfect set of circumstances. And of course, the perfect set of circumstances, unfortunately, are so rare in our common society, in our current society, that I think it probably speaks to a lot of people's experiences. Well, that carried over into grade school, junior high, and high school to varying degrees. In high school, I very poor grades, very poor interactions with teachers, and it coalesced into a conversation that my parents and I had with one of the principals, and he basically told me that it seems like I have a multitude of learning disabilities, and probably the best thing for me to do would be to go to vocational school and learn a trade, and just kind of stick with that, and make the most of my life that I could doing something like that, because reaching for any type of higher education would only produce failure and more negative feelings on my side. Of course, he was in no way a trained psychologist or psychiatrist or even a counselor. This was just his best guess based on his experience as a principal. So that was, looking back on that, it seems rather irresponsible, and I wonder, how many other people he had coached in a similar direction that might have had a happier life with less negative effects based solely on his presumption and diagnosis of people having learning disorders without the proper background or education to be able to diagnose such. So, given that information and my experience in school, it was kind of evident that I was not going to have a great life at it. And that can be quite a setback for some. Of course, this isn't, a terminally ill cancer diagnosis, but it's also a diagnosis that no one really wants to hear. And given the tools that we had, I had no way of evaluating for myself if this person's information was correct or not. He was the principal of the school, so I figured that he probably knew what he was talking about. So based on that, I kind of fell into a depression and got a little bit more dysfunctional, and ended up, experimenting with various kinds of drugs and abusing alcohol and displaying a fair amount of antisocial behavior, and it was difficult to maintain friendships, and I was kind of an angry person, and that can have a negative effect on someone's life in the best circumstances. So in using my various forms of drugs that I experimented with, probably in some form of self-medication to kind of quail the depression, I eventually tripped across, no pun intended, LSD, and I got a hold of that at a fairly early age, and did a fair amount of it, and it did have a positive effect on me. It was used more recreationally, but at certain points, there's no way to not kind of take a look at yourself and evaluate your personality. And kind of what LSD did for me was, and I'm not promoting this for anybody, at no point in time am I saying that anyone needs to run out and take LSD or mushrooms or ecstasy or any of these other chemicals that I'll be talking about. This is merely my own personal experience in the area. So in using the LSD, I was able to examine some of the negative habits that I had formed, and some of the areas that I had formed a serious case of denial in. So I wasn't looking at very, very consciously, and was able to make some changes and kind kind of take a step outside my ego, and rather than look at myself like other people looked at me, I was able to get a clear picture of what I had done in my life and what accumulated to create my personality and who I was. So that was freeing in that way, and I was able to kind of take a more objectionable look at or a more objective look at my reality and the situations I was in, and using those tools, I was able to evaluate better directions to go and better uses of my time and things to focus on. Eventually, I made my way to mushrooms, and I have to agree that this is kind of more of the spiritual awakening. I don't practice any type of Christianity or any form of organized religion, but at this point I was able to experience for myself what someone might consider metaphysical. And of course that's my opinion. That's not any incontrovertible evidence or scientific proof of anything, but spirituality should be something that's personal. It should be something that exists on a personal level that you should be comfortable with. It should be something that helps you with life and isn't necessarily, you don't need the consensus of everyone else to justify what you feel and validate those feelings. So that helped me kind of develop a sense of something else, something greater in the world, something else to look forward to, something, that's not just whatever my negative perspective was up to that point. And you don't have to have spirituality or religion or anything like that. Atheists, I'm absolutely glad to be friends with atheists, and we really don't discuss these things, and that's fine. We avoid religion and politics as often as possible because they can be rather polarizing. But I digress. So psilocybin was able to help with a number of things, and it kind of gave me an awe of the world of there are many other things to explore, and that given the right set and setting, this would be a lot of fun to kind of do the inner space kind of exploration. And compared to some of the other drugs I was up to, it's much easier on the body and much less expensive as well. And probably about that time, I started tapering off some of the more negative substances that I was doing, though still drinking pretty regularly. Later on than that, even probably the early 90s, I started experimenting with MDMA and ecstasy, and that's kind of when I had some of the more major breakthroughs, kind of was able to examine some of the systems in reality and how the world works and my interactions with people, and I could see how I had developed blocks in certain areas that prevented me from moving forward, and how that was frustrating me on kind of a subconscious level, how some of my drinking was affecting people around me and it was affecting my health, how I had developed some negative social habits and somewhat narcissistic tendencies in other areas. And it could be a real bummer to be around. And that's, though someone may not necessarily consciously know that that's happening, they definitely can pick it up subconsciously in some of the responses from other people and things like that. So it's kind of a sense of knowing that something's wrong, but not knowing exactly what that thing is that's wrong. So it helped me to work through that, and I actually started taking the MDMA like no more raves and not in any clubs, but actually taking it at home by myself, listening to music with the intent of examining some of the things that were happening in my personality that I would be able to take a closer look at. And it helped me make a lot of breakthroughs personally. Again, I'm not saying that anyone needs to run out and do ecstasy or acid or mushrooms or anything. This is just my personal experience with these substances. So in that timeline, it seemed like some of the breakthroughs that I made, the LSD was kind of a personal interior examination of some of the things that I was doing, more so helping me look at things that I was avoiding looking at, the mushrooms kind of helped me look beyond myself and beyond my community out into, the metaphysical of things that I couldn't necessarily see, and kind of get me interested in thinking about, well, what exists outside of my senses and things like that, which kind of gave me a sense of awe and wonder about the world around me. And then moving into the ecstasy stage, it was kind of more examining interpersonal relationships and the dynamics of the people around me, and even at times the world at large. So it was kind of, different stages of our consciousness, of my consciousness, that I was examining, the personal, the societal, and then the meta-societal, metaphysical. And I can't tell you how much of a change in my life that these different experiences had. It helped not only with some of my personal emotional problems, and helped me deal with some of the family issues that we had, but it also helped me understand people around me in the immediate time. And it was interesting. So to carry on with it, this was, so I various problems. Then I'm told that I've got learning disabilities, and then on to a life of partying and not really caring about anything, and kind of degrading my personal personality and interactions and relationships and things. So moving through the various stages of these different psychedelics, I was able to kind of do some repairing and work on my insight and things like that. So eventually, what really kicked off the change and pretty much changed my whole life, more or less revolved around, I got into a situation to where I had my IQ tested. And of course, there's any number of stipulations when someone's getting their IQ tested. The things that it tests, the accuracy of the test, there's a number of different tests that you can take, and all of them will probably say different things about you. And the IQ test itself is I wouldn't call it the most accurate thing in the world, but it's something that's standardized that we can use to kind of compare ourselves to others. So in taking this test and getting the results back and exploring what those results meant, I found that I was actually had a pretty high IQ, and I tested in the top 1% of the people in the world. So it took me a while to kind of wrap my head around that, and probably given the trouble that I had in school, it was not necessarily that I had like learning impairments, but it was probably had something to do with I wasn't focusing on my particular type of learning skills. As I've grown older now, I can see that there are some people benefit from different types of learning. Like personally, I don't do well in like large group settings, like a classroom. I do personally like with a computer at this point, where I can just stop and study and study one subject for an extended period of time with no distractions, and if I need help or advice or explanations, then I can reach out to someone. But in fact, when I was in a classroom and doing 7 different subjects a day, it affected the way I was able to focus on things, and it was probably the worst conceivable way for me to go about learning different subjects and situations. So at that point, I reevaluated the advice that the principal gave me, and realized that I wasn't a person that was damaged and really didn't have much of a path in life, given that information, in his early teens, that it was a systemic failure in the education system, in my opinion, of being able to identify different learning systems and kind of catering it to the student. And he actually probably did me a great disservice with his casual off-the-cuff remark. Lord knows how many other people he affected that way. But fortunately, through various forms of psychedelic therapies, and eventually this test to kind of confirm that, no, I don't have, I'm not stupid, that I actually have the potential to be a very effective learner. And I'm not saying this to toot my own horn, but I mean, given the probably 25 or so years that I spent thinking that I was a problem, I'm hoping that by sharing this experience with other people, that they might be able to glean some inspiration from it and say, no matter where you are in your life, there's always the propensity, there's always the possibility for improvement and change in an effective way, and you know, help you become a better person. So that's my story. That's kind of how I got to where I am now, and that was over a decade ago that I got that information, and I'm really happy and comfortable with the person that I am now, and I don't hold any grudges or any anger or anything like that. Of course, I'm a little disappointed that someone who lacks the knowledge to give out those kind of diagnoses was able to affect me in such a way. But I'm hoping that as we progress as a society and as technology progresses, that we'll be able to fix some of those problems and focus more on customizing solutions to the individual rather than hoping and forcing the individual to customize their skill set to kind of a one-way standard that's supposed to fit everyone. So, in closing, these things, this wasn't like a medication that I have to take every day. This wasn't something that was very expensive, that I didn't have to take anything to counter side effects or anything like that. Much like the participants of the study that we examined today, this was like a one-time treatment that stuck with them for months and possibly years, and increased their happiness in their life, and had a very deep change, occur, and was very positive. So I think that's looking at the paradigm of being able to cure something and comparing it to the current paradigm that we have of an ongoing treatment, which appears to be something that the pharmaceutical companies support because that's their bread and butter. If they gave you a pill that cured you of something, then that's a one-time payment that they get, and that'll eventually run out. But if they can give you a pill that treats you, that you have to take for the rest of your life, and sometimes multiple times a day, and then here's this other pill that you have to take to offset some of that stuff, well, that's just compound income for them for, the life of the unit that they're prescribing it to. So hopefully we can get a better grip on that, and I'm very happy to see some of these studies come to life, and it's interesting to take a look at them and see what people are learning. So like I said, I will link to various sources of further study that you can do on your own. I will be linking to Dr. Grob's Erowid page. I'll be linking to the Hefter Institute, which I didn't touch on very much this time, but they are funding and helping create the methodology and helping get these different studies through the FDA. I'll link to the video presentation that Dr. Grob did, where I got a lot of this information, and I'll link to the MAPS website. So I would like to thank you very much for listening, and we will talk at you later.